Hi, Dr. Mora here. How are you, everybody? We're bringing you cutting-edge Mora, cutting-edge orthopedic surgery. I wanted to show you what a bucket handle meniscus tear looks like on a model, okay? And then I'm going to show you what it looks like on an MRI. It's very important that you're able to identify these tears if you're a healthcare provider or physician, somebody that's actually evaluating people with knee injuries, whether you work in urgent care or you're a resident, family practice, rheumatologist, whatever. If you're looking at knee MRIs, I think it's really important that you can identify this particular tear, because this tear needs to be treated differently. This is the bucket handle meniscus tear that's displaced. So usually there's some sort of trauma. So athlete missteps or a worker missteps and they feel immediate onset pain, and then they can't really extend their knee very well. So once again, knee, just to give you a little anatomy, a summary here of what we have here in this model: femur bone, tibia bone, lateral side, fibula, fibular ligament. Open up the knee like this, and what do we find inside the knee, which is what we find in real knees as well? We have the lateral meniscus and the medial meniscus, and these are these pads, okay? And they're semi-lunar type shaped pads. They're rubbery, firm rubber like this, and they provide a cushion type of effect in the knee when people get hurt. So now, let's say you have a patient, once again, some sort of trauma, and they twisted the knee, and now they cannot extend. That's the key point. They cannot extend their knee. It's swollen. They might be able to walk on it, but they walk in an abnormal way, because when they take a stride forward, they cannot extend the knee. And you may think that it's extending fully, but when you compare it to the other side, it's missing maybe 10 degrees, which isn't a lot, but but you can tell when they walk. So number one, trauma, swollen knee, cannot fully extend it, and tender. You do the examination, there's an effusion, there's swelling, and once again, they flex the knee and they're like, yeah, I can flex it pretty good. You go to extend it, they can't extend it all the way. So you have to suspect that they have some sort of a ligament or meniscus injury. So what I'm going to show you is a real case. That's exactly what happened to one of my patients, and we did an MRI. Now, before I show you the MRI that's going to highlight how to identify a bucket handle tear, let me show you on this model. So lateral meniscus, medial meniscus. So what happens with a bucket handle tear is the tear is unique in that it's a long tear like this, like right in the middle of this meniscus, like right in the central aspect of the meniscus. And it's a tear that goes all the way through. It's almost like taking a knife and cutting through all the way through. So what that does is it creates a flap like this, you see? And this flap will move back and forth like this. And because it moves back and forth like this, and because it looks like a bucket handle, it's called a bucket handle meniscus tear. And when the flap is displaced over here, then it does not allow the knee to fully extend. So that's why the telltale sign is loss of extension. Some people say it's a locked knee, but this would be a displaced bucket handle lateral meniscus tear, and this is what we would look for on the MRI. These are the key points that we look for on the MRI. Number one is on the sagittal image. Sagittal means side view, like this. You're going to see this strip over here. Here, let me put it over here so we can have this, this monitor as a backdrop here, okay? So once again, on the sagittal image, which means side view, you're going to have this limb right here, which is actually parallel to this structure right here. This is your PCL. So on the MRI, what you'll see is a double PCL sign. That means that you see this piece and you see this piece, and they're almost parallel to each other. You see, let me go like that. See, that's how you'll see something like that. I'm not sure if you can capture that, but it's called a double PCL sign. Number two, you might be able to see this piece right here, this longitudinal piece right here. You might be able to see that. Number three, on the coronal view like this, what you'll see is that you're missing meniscus. there's actually like a significant amount of meniscus here is missing. Why? Because it's over there. So some people would think, well, maybe they have arthritis and maybe that's why they don't have meniscus. No, that's not the case. The case is the bulk of the meniscus flipped, left the normal site, and it's over here. So on the MRI, what you see is a lack of meniscus over here. And if you're lucky, you might see this strip right over here, okay? So that's what we look for when we suspect a bucket handle meniscus tear. And while we're here with the model, I'll tell you that another thing to look for when a patient presents with that type of a trauma, but it's usually somebody who's a little bit more overweight, is a different type of tear. This is another type of tear to look for with that type of history. Some people present with what's called a root tear, which is a tear over here. See, a root tear is a tear over here. I'm not going to show you an MRI of the root tear because I've posted this on Instagram before, but a root tear is one where it's in the back of the knee. This is the back, this is the front, and it involves a root, and usually when it tears, it goes like that, and you end up with a gap. You end up with a gap right there. So that would be a root tear, which you also need to learn how to identify on an MRI if you are a person that is evaluating people with knee pain. So why don't we step over here and look at the MRI, and we will go over everything that I just went through just now. So let's put up an MRI here of a patient that suffered a tear of the lateral meniscus. Let's start with the side view, which is what I mentioned, where you see the double PCL sign, and sometimes you can see that extra limb. So here we go. This is a sagittal image right here. So sagittal means it's a side view like this. Okay, it's a side view like this. Okay, what we're looking way over here. So once again, it's a flip meniscus like this. Okay, so once again, it's missing meniscus here. We're missing meniscus. Where's the meniscus? It's got to be somewhere. So we're going to find it. There it is right there. So see that piece right there? That is this displaced piece right over here. This big long piece that goes from here to here. It's right there. Right there. You can really see it right there. That structure is not supposed to be there. We are in the notch. This is not supposed to be here. So this just that image right there should make you suspicious that you have a lateral meniscus tear. So now let's go back this way one more time. Boom, there it is. That's that one strip. Now in this particular view here, we don't have the double PCL sign. So I don't see a double PCL sign because that's usually with a medial meniscus, with a lateral meniscus not as often. And then when we look at this view over here, this is this view, frontal image of the knee. Okay, what do we see on this view? Lateral meniscus is over here, or should be over here. And I say to myself, where is the meniscus? There's no meniscus here. Why is the meniscus not here? It's not there because it's flipped. This is actually a left knee. It's flipped and it's over there. Okay, there it is. That little piece is not supposed to be there, and that little piece is this piece right over here. Okay, so once again, lateral meniscus tear, bucket handle type of tear, displaced fragment right there, right there, right there. There you can see it better. And on this view, no meniscus over there, abnormal flap over here, lateral view over here that shows the strip that's not supposed to be there, lateral meniscus there. So it's very important that if you are evaluating patients with knee trauma, you know how to identify a bucket handle tear, because it's important. Because if you let this patient fly and they just say everything is fine, all they have is a strain sprain, they actually don't have a strain sprain. They have a tear that's repairable, and if you repair this meniscus and if it heals, then the knee mechanics are reestablished, and the cushioning effect of the meniscus is reestablished, so then the likelihood of arthritis is very low. But if you let the patient go with a strain sprain diagnosis, then they're going to be walking on a knee that doesn't have a meniscus, and the piece of meniscus that's flopping around like a bucket handle is damaging the knee, and then they can't extend their knee, which makes their that affects their ability to walk. And in the long run, the longer they wait, with a tear like that, the less likely that it will heal up because it gets damaged. So once again, Dr. Mora, bringing you more cutting-edge orthopedic surgery here at Restore. Hopefully that was educational and you learned how to identify a lateral meniscus bucket handle tear in a patient with recent trauma. I hope you guys have a great day. Have a great weekend. Talk to you soon. Thank you very much. Bye-bye.